Hey, everybody. Thank you for joining us this evening for another round of Protecting the Vision here at the National Optometric Foundation. As we're bringing these live shows to you to educate the community, making sure that people who are connected to this live broadcast are educated about their eyes. And we do different topics, and we've been doing this since the beginning of 2022. And we're happy to bring you another live show here for July. The topic for this day is going to be dry eye and UV safety awareness here. And I'm so excited to be able to talk with you as one of the guest speakers here, along with my colleague, Dr. Sabrina Reed, who is also going to drop some great information with our listening audience tonight. So go ahead and make sure you share tonight, share this. Make sure you go ahead and go to our National Optometric Foundation page and like our page. And we want you to make sure that you go to our YouTube channel and make sure that you are following us on YouTube. You can look at some of our videos from the past. You can share this with your family and friends, making sure that you are passing along this education that our doctors and our guest speakers are providing to our listening audience on a monthly basis there. We don't want you to just keep all of this to yourself. Share it. Let's grow our community and the wisdom and knowledge that's shared on these live shows each month here. So a little bit about who we are as the National Optometric Foundation. We are the financial supporting arm to the National Optometric Association. And what we try to do together is make sure that we are supporting our communities, supporting them in ways of doing free eye exams and free glasses, as the National Optometric Association was able to do in Anaheim, California this past week. They did eye exams, and many people left with free eyeglasses as they did that at the National Optometric Association convention for 2022. And we're so thankful for all of those who come along as sponsors, financially supporting the NOA and the NOF, so that we can also provide scholarships to students who are in optometry school, students who are thinking about going to optometry school. We give scholarships to them as well to support them while they're in school for their expenditures that they have, or trying to help them get to convention. We also try to educate our patients. We like to make sure that people are aware of the 3 silent killers of your vision, which is glaucoma, diabetic retinopathy, and hypertensive retinopathy. So we have pamphlets that we try to share with communities and with patients, educating them about that, and making sure that this knowledge is shared among people, because we realize that people don't always know what they need to do in order to protect their vision. And so tonight, I want you to listen in, go ahead and get comfortable as we talk to you about dry eye, and we talk to you about UV eye protection there. And make sure that you go to our website. We have the National Optometric Foundation website as well. Make sure you go to our Facebook page. Make sure you connect with us on our YouTube page. And also, we want you to know we have a Cashapp. Our Cashapp is available to all of you generous people out there who would like to support us any way that you can, so that we can continue to do the great things that we're doing in the communities there. Okay, so let me go ahead and get into the show, because we have some great information that we want to share with you tonight. My name is Dr. Timothy Brown. I am the treasurer for the National Optometric Foundation, and I am going to be one of the guest speakers with you tonight. I work along with my wife, Dr. Sharita Brown, at Insight Family Eye Care in Augusta, Georgia. We see adults, we also see children, and one of the things that we specialize in is seeing children at the office, and also doing vision therapy when their eyes are not working together as a team. So I'm very thankful to be on the show. I'm also an Avon representative. I am also Mr. Positivity on social media, and I believe that every single day you should start your day with a positive mindset to help you get along the day a lot better. So I want to bring on my colleague here, because she is so full of wisdom, and she's going to share some things with you. Dr. Sabrina Reed is a medical optometrist at Lawndale Christian Health Center in Chicago, Illinois, where she integrates faith in healthcare. She's a fellow in the American Academy of Optometry, a distinction achieved by only 10% of all optometrists. Dr. Reed is certified to do clinical research, and Dr. Reed is also a life member of Alpha Kappa Alpha Sorority Incorporated. Dr. Reed, welcome to the show. I'm so glad that you are doing this show with me tonight because I know that you are going to have some great information to share with our listeners. So I just want to say welcome, welcome, welcome to the show, Dr. Reed.
Thanks so much, Dr. Brown, for that grand introduction. And I'm so delighted to be with everyone this evening to share and try to just give some insight into something that affects lots of people um, around the country and even around the world, dry eye, and letting everyone know the importance of protecting their eyes from the UV rays of the sun. So, once again, thanks for that great introduction. It's great to be with you this evening.
Absolutely. And so we know that a lot of people suffer from dry eyes. We know that sometimes people don't realize when they have dry eyes. Sometimes they walk into the office and they will say certain things that may trigger that, hey, this patient could be suffering from dry eyes, based on what they're telling us. Sometimes as you're using your eyes all throughout the day, all throughout the month, that can lead to dry eyes. Your certain environments there that we'll talk about later on today. So, Dr. Reed, I just want to know, as you're going and you're seeing patients there, what do patients sometimes say that may trigger you that they could be challenged with dry eyes when they're in your office?
Well, two of the hallmark symptoms that my patients will frequently come in with complaints of are, Doc, I feel like I have something in my eyes. They feel like I have dirt or trash in my eyes, or they'll say, Doc, my eyes water all the time. My eyes watering, my eyes water. And so typically, as soon as they say that, there are other symptoms of dry eye, but those two are typically dead giveaways for dry eye. You will often feel like there's something in your eye, like dirt or trash. We call it a gritty or sandy, or we call it a foreign body sensation. Some people will also um, question how their eyes could be dry if they water all the time. But the reason that the eyes water is because your body tries to correct whatever's wrong in the body. We're just designed that way. And so when the eyes are dry, the body tries to compensate for this by producing tears to try in an effort to lubricate the eyes, essentially. So those are two of the main symptoms: a lot of burning, sometimes redness, sometimes itching, sometimes pain. There are different levels of dry eye, and certainly many factors that can cause it. But those are some of the main symptoms that when people come in, even my assistants, my technicians now know they can pretty much diagnose it a lot of time themselves before the patient even gets into me, just based on those symptoms.
With you 100%. Those are the hallmark signs and symptoms that we hear, we see from patients coming in the office there. I feel like I have trash in my eyes. It feels, really sandy, uncomfortable. They just feel like they want to clog their eyes out and things of that sort. But you're absolutely right. Many patients don't understand how can my eyes be dry when they're producing so much moisture. I'm tearing all the time, all the time. Doc, are you telling me the right thing? But you hit it right there, the nail on the head there. The eyes, the body is trying to compensate for the dryness there and start saying, hey, we need to produce some more tears there. So put in the comment section, those of you who are listening, have you had to deal with this? Are you dealing with this now? This is something that a lot of people are not aware of. So we want to take time to make sure that we are talking about this so that you all are educated about it and that you can talk to your local optometrist about these things so that you can get treatment. And treatment comes in many different forms. It depends on the condition of the eye. It depends on what the doctor may see when they do certain things while you're there for your visit, for your eye exam. So we'll talk about the treatments later, but one of the things I want to make sure that you guys are not doing, do not delay scheduling your eye exam today. Don't delay, do it today. So if you're listening to us tonight, tonight we are centered around the theme protecting the vision. And as we speak about these different conditions of the eye, diseases of the eye, we want you to know that you need to schedule an eye exam. Even if you may not think you're having any problems, go in to see your optometrist and tell them you want a thorough eye exam there. You want a complete eye examination with dilation if possible as well. We don't want you to walk around suffering from discomfort when there are solutions to the challenges that you may be facing. So if you're dealing with these challenges, go ahead and make a comment in the box there. Tell us what you're going through. If you have questions tonight, go ahead and put your questions down in the comment section and let us know what questions you may have there as well. Thank you, Dr. Reed. That was very good. Those are common things that people say when they come into the office. Those are things that we hear often when they come in the office. Sometimes people can't wear contact lenses, because they are dealing with dry eye issues. And sometimes people are disappointed because they do come in for their eye exam and we have to tell them, hey, based on our findings, based on your complaints, this is what we found. And we need to delay doing your refraction for the glasses for right now until we take care of the dry eye issue, take care of the underlying condition, because it's affecting the front surface of your eye, the cornea there is affected. And when that's affected, it affects how light comes into the eye. It affects how the doctor comes up with your glasses prescription, not even talking about contact lens prescription yet. So those are reasons why your doctor may not have been able to complete your eye exam when it comes to getting you ready for glasses. Have you ever had to pause your eye exam, Dr. Reed, because of dry eye issues there?
Oh, sure. For some of the more severe cases, often people will come in with, whether it's a mild or severe case of dry eye, another complaint could be just blurry vision. And so when people have blur, of course, and naturally, they would assume oftentimes, and it may not be completely correct, that they're in need of glasses. And so sometimes when they come in, they're seeking glasses.
Right.
But when we look at the health of the eye, we can often see that, it's very, very dry, almost looks sandpaper-like. And we know that glasses are not really going to solve that issue, that we do have to deal with the health of the eye first and get the cornea, as Dr. Brown was stating, back in good condition through some form of treatment, and clear that up before we can proceed with checking the vision and checking for glasses and things of that nature. The other thing that often people will say is, my vision is blurry. And I'll say, well, does it clear up when you blink? And if it clears up when you blink, and sometimes it clears up on blink, even when we're checking you for the glasses prescription, we know that every time we blink, it's our way of coating the eyes with fresh tears. And if you clear up on blink, that's another telltale sign that you've got a dry eye issue that you're dealing with. So
Right.
those
Absolutely.
are couple clues for us when you come into the office.
Right. And as I sit here, I'm listening to you talk about tears, and some of our listening audience there, they may not know, healthy tears consists of water, oil, and mucus. And when those layers that coats the eye, she was talking about, as you blink, you're coating the eye, you're replenishing your tears. When those layers are not in the right proportion as they should be, that can lead to the front surface, the cornea, not being smooth, and that can cause you to have that blurry vision. It can cause you to have that gritty feeling, indicating that your tears are not healthy for whatever reason it may be. And we talk about this because it's important. If you don't go to an optometrist and an optometrist check your front surface of your eyes for this, you may not know the reason why you're dealing with this. You're walking around knowing that something's not right, but you don't quite know what it is there. So we want to encourage you to go get checked. Let your optometrist do what they have been taught to do, what they're skilled in doing, and examine the front surface of your eyes and make sure that everything is looking good for you. And if it's not, then give them the opportunity to be able to take care of that underlying cause before they move forward with your glasses prescription. Because the last thing you want to do is get a glasses prescription only to find out later that it's different and you're not seeing as well with that glasses prescription as well. So have an eye exam. And one of the reasons why I'm pausing a little bit here and just going over this is because it's more than just getting glasses. As you hear Dr. Reed, she just mentioned, we have to look at the health of your eyes, making sure that things are in place, that the health of your eyes is in place. We always tell people that we can put a pair of glasses in front of your eyes, but if the front surface or something in the middle is not right, or something in the back of your eye, the retina is not right and something's going wrong, the glasses are not going to do what they're designed to do there because of that. So just want to make sure you guys understand that an eye exam is more than getting glasses, So make sure that you are taking notes. Make sure you're sharing this with your family and friends, your followers here, because this is information that everyone is not aware of. So that's why we want to take time and make sure that we give this out to you. So I was getting ready to talk about artificial tears, but we can talk about that later, because I know sometimes we talk about problems and then we want to talk about solutions. So is there anything else that you would like to add on, Dr. Reed, in regards to patients, their experience when they come in, you having to deal with dry eyes before you complete their examination? And then we'll talk about treatments for patients.
Well, I think probably just I guess this can go along with treatments, is talking about some of the causes of dry eye. Sometimes it can be related to your medication. There are certain classes of medicines that if you're on medication for diabetes or high blood pressure, you're on anxiety medication, antihistamines, or decongestants as allergy medication, those things can contribute to dry eye. Device use, when we're staring constantly at devices, whether it's for work or for leisure, for school, those things can contribute. We're not blinking as much as we should. There's a thing called visual hygiene. We want to make sure that every 20 seconds, we take 20 minutes, we take a 20-second break, look at something 20 feet away, so that we can, just blink and kind of refresh that front surface of the eye. And some people, when they blink, their eye doesn't close all the way. Anybody out there know somebody that doesn't close their eyes all the way when they sleep? Looks kind of weird. Yeah, well, those folks oftentimes don't close their eyes all the way when they blink, and their eyes dry out. They dry out overnight. A lot of people dry out at bedtime. You sleep under a fan. It's warm out, or you sleep right in front of the heater. There are lots of things, whether it's environmental. Some people don't drink enough water, or it's side effect of medication. Lots of different things can contribute to dry eye. Sometimes it's just age. It's hormonal changes in ladies, and and everybody as we get older. Sometimes things just kind of start to dry out. That's just part of life. But whatever the cause may be, certainly we as your local optometrist want to help you find a solution. If you have a dry eye, contact lens definitely is going to make it worse. But we have a few tricks and tools up our sleeve, tricks up our sleeve that we can employ.
Yeah, so what Dr. Reed was talking about for sure, a lot of times people will have their significant other tell them, hey, last night while you were sleeping, your eyes were not completely closed. And that's one of the indications to them that they have something going on by their eyelid not closing together. And that can lead to dry eye issues as well there too. So many things Dr. Reed was also pointing out with your medications. Certain medications, they're good for taking care of what they're designed to take care of. but also those medications, they have side effects. And sometimes the side effect is dry eye, So your antihistamines, as she was mentioned, it can be good. It helps with the sneezing, so you can decrease that, but you also got the dry eyes going on there as well as a side effect there. So, Shay Carter, I noticed that you said that you have dry eyes and your eyes are burning sometimes, and your eyeball is aching. Make sure you, Shay Carter, in our audience there, thank you for sharing that with us, but make sure that you go ahead and get your eye exam scheduled with your local optometrist so that they can do the examination to kind of get to the root cause of why you're having this burning sensation there, and try to get some treatment options out to you as well there too, because you don't have to walk around every day in discomfort. There are solutions out there, and you just need to have that conversation with your optometrist. We talked about on one of our shows, having a dialogue with your doctor is important. Don't go to an appointment and feel like the doctor is the only one who gets to speak at the appointment. We want to make sure that it's two-way there, the patient and the doctor. The doctor is doing their examination for you. You should feel comfortable asking questions about the findings, sharing things about what you've been dealing with your doctor, because that's what we're here for. We're here to have that communication with our patient so that we make sure that we are understanding what it is that you're going through and try to help you get through that challenging situation there with your eyes there. Okay. So good pointers, Dr. Reed. I was just following up with what you're saying. Sometimes a spouse tell their significant other, hey, your eyes were not closed last night while you're sleeping, and they may come in and tell you that, and that can help you, have that clue to, hey, this person could be dealing with dry eyes because of that that their eyes are partly open, at night there as well. So I was just following up with that, and
Yes.
you're right on the money as well there with the medications. I was telling them certain medications you're on can have a side effect of dry eye as well there too. So I'll let you go ahead and continue what you were talking about.
I have had some experiences where some of my pediatric patients will come in with dry eye as well. A lot of times they are they're on devices. A lot of the parents try to prevent them from being on the devices, but when a lot of young people are not in school, a lot of them couldn't do their normal sports and other types of leisure activities with friends because of, especially during the pandemic. So they're at home, they're doing virtual school, virtual learning, they're on devices all day for school, and they were, in their free time, their leisure time, a lot of them do a lot of gaming, movie watching, things like that on devices. And so I will have teenagers, even smaller children, come in with complaints of blurry vision. We've done a whole thorough exam and, just done every test in the book, and everything's pretty much coming up normal. And when there's a complaint like that and everything's coming out normal, then I start to think about dry eye testing. We have certain tests we do where we stain or put a dye, almost like when you have tests where they have to put dye in your body to be able to illuminate certain abnormalities. We have dye that we put into the tears to check for certain qualities that the tears should display, and also check the front surface of the eye. And oftentimes on children, they'll have dry eye, and you'll say, "Aha, this is what it is." And usually for them, it's a simple fix. Sometimes for adults, it can be a little more complex. But we typically will start out recommending artificial tears. It's just lubricating drops for the eyes, and there's different formulations depending on, if you have a mild case or moderate or severe. There's gel version of the tears. There's ointment version of the tears is similar to Vaseline, when our skin's really dry and lotion's not cutting it, especially in the winter months. We'll use something thicker, and the same thing applies with the eyes. We often will examine your water intake and just be sure that you're hydrating yourself well. And there's also a potential for an inflammatory component or reason that your eyes are dry. We have glands in our lids. They produce oil. It's a part of that oil layer of our tears that Dr. Brown mentioned earlier. And so if those glands are inflamed and they're not producing oil in the proper liquid form, sometimes we will recommend warm compresses to help keep those oils in the liquid form. And sometimes that oil will look like melted butter, like it's supposed to. Sometimes it looks like solid butter. It's coming out of our eyelids onto our eyes. And so we have to do sometimes warm compresses, special lid hygiene, cleansing the lashes. A lot of times we have, we need supplements like omega-3 fatty acids or foods rich in omega-3 fatty acids to help with inflammation. And then for more severe cases, there are medicated treatment. Medicated eye drops that we use for treatment. But there's an arsenal of things and levels to what we prescribe. Sometimes things like Restasis, those are medicated eye drops for dry eye. Sometimes we have to put patients on an actual steroid, which is a stronger anti-inflammatory for dry eye. Sometimes there are cases that where people need procedures. Something like we have punctal plugs that we can put into your puncta, which is where your tears drain off to keep your tears from draining off of your eyes. That's for a more severe case. And there are other procedures for extreme cases, things called tarsorrhaphy. And there's some new dry eye treatments on the market that stimulate. They go through your nose and stimulate tear production in that way. So it's really an exciting time in the in the area of dry eye management, because there are a lot of things that we didn't have at our disposal before that are really giving patients a lot of relief.
You have checked off a lot of boxes, and have dropped a lot of knowledge there on our listening audience when it comes to dry eye relief. And depending on the severity of the dry eye, the doctor will make a decision to start with this treatment versus that treatment. And Dr. Reed went from artificial tears, which mimics, our healthy tears in our eyes there. So we have artificial tears that you can get over the counter that you may see in stores. They're all different colors and brands out there. Just want to put out that we don't represent any particular company or anything of that sort. So if you hear us say certain names, that may be just something that's recommended sometimes to patients there, but we don't represent any company when it comes to that. But she mentioned from artificial tears down to drops that help curb the inflammation. When the eye is inflamed, you need sometimes medication that's going to help decrease the inflammation, that's going to then also help decrease the complications that you're having with the dry eyes there as well. Dr. Reed also mentioned about steroids. That's something, that she's saying, hey, sometimes we have to pull that out as an option for treating patients with dry eyes there too. So see your optometrist is what we're really trying to say. Protecting the vision. See your optometrist. Talk about these things that you're dealing with when it comes to your eyes, and make sure that you're not walking around suffering from dry eyes there. Later on, we'll talk about UV protection and everything there, and things that can happen if you're not protecting your eyes from the sun. We also want to remind you all, the National Optometric Foundation would love for you to follow us. Follow us by liking our Facebook page, the National Optometric Foundation. Connect with us through our YouTube page, making sure that you're on there as the National Optometric Foundation on YouTube. We also have a Cashapp. Our Cashapp is available, $ protecting the vision, for those of you who want to support us and help us to continue to do the great things that we're doing for optometry students, for optometrists, for people in the community as well there. And also our website, we have our website available as well there for you to follow us. We have our monthly videos that we've been doing on our YouTube channel so that you can go back and watch those. Get the education that's provided from different doctors. We had some cardiologists on the show, we had gastroenterologists, and we had optometrists on the show there too. So I just want to go back over that and let you guys know that we're here to help protect the vision. When it comes to dry eyes, we know that you guys can have certain signs and symptoms that you may be dealing with, and we want you to know that walking into an optometrist's office, having that discussion with your optometrist is the initial start to finding relief from dry eye. And Dr. Reed just shared a wealth of information about dry eye relief, and she'll be back. She'll come back and talk to you a little bit more, because I know she have other things that she would like to share with you when it comes to dry eye. I'm just going to shift gears a little bit because we're like halfway into the show, and try to give you some understanding about protecting your eyes, UV safety awareness here. This is half of the show that we wanted to make sure that we give a little bit of information. I won't be before you long talking about it, but I want you to know that about this topic, because a lot of people don't understand it, and they don't understand how their eyes can be harmed from the sun's UV rays there. You know, we got longer days now. Summertime is here. Summertime. Yes. So longer exposure to the sun's harmful rays, UV rays there, UVA, UVB. The best way for protection is having sunglasses that's blocking 100% UV rays, blocking both UVA and UVB. So when you're shopping, make sure you're shopping for the right thing. Sometimes we go in the store and we pick up something that looks cute, the fashion there, it looks cute, but we want to make sure you got the proper gear on to protect your eyes. This is not mine. I just want to show you guys here what looks cute, and want you to know that instead of looking only for what looks cute, make sure you get something that's 100% blocking UV rays there for you as well. Polarized sunglasses is my choice as well there too, and I'll tell you why later on. But polarized, I even have mirror tint polarized sunglasses here as well that I recommend that you try to get there too. This is my own personal polarized sunglasses. I always tell people when they're in the office that I recommend polarized lenses, and it is the only way that I want to be driving along the road with the sun coming into my eyes, especially when I'm driving for 1, 2, 3 hours on the road. Polarized sunglasses there. There have been times where I've turned around to make sure that I got my sunglasses with me, but now I have multiple, and I keep them in the bag. I keep them in the car when it's not hot, and I also keep one at home so I can make sure that I'm always protecting my eyes when I'm driving. Sometimes my friends ask me, why are a lot of your pictures you wearing sunglasses? Well, this is it. I'm trying to protect my eyes and look cool at the same time. So, but the main thing is we want you to protect the vision, protect your eyes with the sunglasses there. Sometimes you remember when you're exposed to the sun, you're going out to the beach, you're going to lay out by the pool. Guess what you do for your skin? You put on sunblock. Well, think about your eyes. They need to be protected as well. So make sure that you put on something to protect your eyes. Polarized sunglasses, sunglasses that's blocking UV rays are what you should be doing. Because if not, natural sunlight and artificial light indoors can cause damage to the eyes. It can cause damage to the cornea, the front surface of your eyes. It can cause damage to the lens in your eye. It can also cause damage to the back of your eye and the retina. So this is why we want to take time to make sure that you understand it's important to make sure you're wearing eye protection early in life. Children should be protected. Protect their eyes, parents. Protect the eyes of our seniors. Help them with eye protection there, because if not, we are increasing the UV exposure there. We want you guys to protect the vision, shield your eyes from UV exposure there so that it's not damaging the cornea, the lens, the retina there. We're highlighting UV safety awareness because many people, they're not aware of the dangers of UV light. And we want you to know that everyone is at risk, whether you're working outdoors or you're working indoors. You're at risk because of the different things that you're exposed to there. So what harm, somebody may be listening and saying, well, what harm can UV light do to my eyes? What can the sun do that could be harmful for my eyes? And I'm glad you asked. You may have heard the word cataracts. UV exposure can increase your risk of developing cataracts early. It can also speed up the process of the cataracts developing in your eyes. Normally, cataracts they develop over time. It's a darkening of a piece of tissue that we're born with. And as we go along in life, we have these encounters with the sun. That tissue starts to darken more over time there. And it takes years. But long exposure to the sun can increase the development of cataracts there. What else? There's something that we call pterygium, where you can have a growth on your eye due to your eyes being irritated from exposure in the sun. The sun is powerful. The sun is a great source of light, but too much or exposed to the sun without your eyes being protected can be harmful to you. Now, we're not encouraging you to go into the house and stay inside all day and lock yourself in and never come out until the sun goes down. No, no, no. You can have safe exposure to the sun so that you are enjoying time exercising outside, letting your children outside, being exposed, because we need that vitamin D. That's healthy for us. We just want you to protect your eyes while you're outside. And I'll talk about different ways that you can protect your eyes from the sun in just a moment there as well. You also put yourself at risk when you're exposed to the sun for a long period of time of increasing the risk of cancer. Long exposure, the UV rays coming in can increase your chances of cancer. And we don't want that to happen. We also want you to understand that you can have something that we call photokeratitis, where you are dealing now with sunburn on the eye, snow blindness. A lot of time people who are living up north, people are in areas where there's a lot of snow. You're exposed to this and you're increasing your risk of this because of the reflections that's coming off of the snow, that's coming off of water, that's coming off of sand, that's coming off of ice that you may not be aware of. So that's why we want to highlight some of these things there so that you are now aware and making sure that you look at things differently when you go outside now, making sure that you're protecting your eyes. And so we talk about the harm that can happen. And some people may be saying, well, what help do you have for me? What tips do you have for me? Some reminders that you may have for me. And I'm glad you asked. So every time that you're listening, we're trying to tell you about what can happen if you do this or if you don't do this. But we also want you to know that there are ways that you can protect your eyes to prevent these things from happening. And one of the things that I've already mentioned was getting sunglasses. Get sunglasses where you're going to block UV rays. Get polarized sunglasses as well to protect your eyes. But another thing that you can also do is get a wide brim hat. So for the fellas, a wide brim hat, may look something like this. I won't try it on unless you guys post a lot in the comment section. Try it on, try it on, try it on. Depending on where you are, you may wear a hat like this with a broad brim there. Depending on where you are, this may be your choice. So you got options of protecting your eyes along with your sunglasses, putting on a hat. So that's for the guys. So ladies, you also have options as well. There you go. You can put on your nice brim hat there as well. You just select your color so that you're cute as well. But the main thing is that you're trying to protect your eyes along with your sunglasses. Not this alone, not just the brim hats alone will do it. We still want you to wear your sunglasses, protecting your eyes from those UV rays out there. So glad to share that with you guys so you can have examples. I'm a visual learner, and sometimes I think about people in the audience who may be like me, visual learners. So maybe if that'll stick with you, it'll also help remind you to wear a hat if you have a hat, wear your sunglasses, make sure that you're purchasing sunglasses that say 100% UV blocking as well there. So and remember, children, senior citizens, help protect their eyes. Do a project in the community where you are doing a fundraiser and perhaps purchasing the proper eyewear and then donating them to senior centers, and also making sure you're donating them to some of our the youth in the community as well. That would be a great project. And I challenge someone who may hear this video now or maybe listening to this show later to take on that project, and let's do that. Even the NOF, we could take on that project with the NOA and do one of those donations to our senior centers and to some of the youth at one of our events that we're having on an annual basis there as well. And just a reminder that I wanted to mention, even on cloudy days, we need to wear eye protection. You need to make sure your eyes are protected. The clouds do not stop the UV rays from doing what they do, which is they can cause damage. Clouds, haze, that will not stop that from happening. It will pass through the clouds and the haze. So make sure, even on cloudy days, if you're out by the pool, wear your eye protection there so that you're not getting exposed to those UV rays there too. Just to let you know, sunlight tends to be stronger middle of the day to the evening time, and higher altitudes, the sunlight is stronger. Just also let you know, when you're around snow, water, ice, there is reflections coming off of those surfaces there. So polarized will help reduce those reflections, block those reflections coming off of snow, water, and ice. And also, maybe you would think people would know this, but I also want to make sure I mention this. Never, never, ever look directly at the sun. Okay? Solar eclipse, don't look directly at them. You know, it could really cause damage to your eyes. Solar retinopathy is what we call it, you know, where you have a retinal damage from looking directly at the sun. You don't want to do that. That's a no. And also, just some of you who may be taking part of tanning beds, that can also increase your risk of being exposed to UV light there. And it can have the same effect as the outdoor UV rays there as well. As I said, we don't want you to lock yourself in a box, lock yourself indoors and say, well, all of this stuff going on because of the sun, I'm just going to stay until it goes down. You don't have to stay inside. When you go outside, just make sure that you got your proper gear. Brim hats, fellas, ladies, and also your polarized sunglasses there. Dr. Reed, I know I talked about some things there. Do you have anything that you would like to add on when it comes to UV eye safety tips and awareness there with our listening audience?
Well, I think you covered it pretty well with the hats. You know, I'm an advocate for eyewear, eye care, beauty, health, and wellness. So
all right.
One of the main
things. Say that one more
time
for the people in the back, Dr. Reed. One more time. What is that you are doing?
That's my new brand that I recently soft launched. It's called Love Eye Care, and it's a brand to promote eye care, eyewear, beauty, health, and wellness. Wow. And so you hit the nail on the head, Dr. Brown, with those hats for the guys and the fellas and the ladies. And so you can protect your eyes from the sun. You can, take care of yourself and still be stylish and look good all at the same time, because trust, all of it's important, and that's facts.
Yes, absolutely. And, I talk about it because some people may not realize that a lot of damage to our eyes can happen at an early age because you're outside. Sometimes you're enjoying the beach. Summertime is going on. You're at the pool. You're at the beach for a long period of time. And you're doing this year after year, not realizing that I'm outside and my eyes are not protected,
Right.
So it's important that we share this knowledge with our listening audience. And I want to encourage them to not just keep it, but share it with your family and friends, and make sure that you're keeping your eyes protected, because we don't want any damage to happen to your eyes. We want to help protect your vision. And that's why we feel that these live shows are very important for that. So thank you for adding on, Dr. Reed. I hope I didn't cut you off or anything. Go ahead.
No. Actually, I did think of one thing that we probably would be remiss if we didn't mention, that the macula is a special area on the inside of the eye where we get our central vision. And definitely sun protection is crucial for prevention of degeneration of the macula.
Absolutely.
That can be a debilitating and sight robbing medical condition of the eyes. And so protecting your eyes, as far as, just some final tips that we want to start throwing out to you all. And we're going to do this for free. Preventing macular degeneration, protecting your eyes from the sun, not smoking. Smoking is terrible for the macula, the health of the macula. And then we've always known carrots were good. Most of us grew up knowing carrots are good for our eyes. But the research actually shows that dark green leafy vegetables are great. So those collard greens and that kale, the kale is off the chart, but all the colored vegetables, the yellow, the red, the orange, the green, those are great for the health of the eyes. So we want to definitely emphasize with the sun protection the benefit that it has for our central vision and our macular health, and a few other things that I wanted to throw out before we close with the dry eye. Just like in the wintertime, when sometimes our skin will get so dry, it becomes cracked. And you hear the term on these lotion commercials about dry, cracked skin. Well, the same thing can happen essentially to your eyes. When we look at them, they can become so dry that, you can develop almost like a crack or like a scratch. We call it an abrasion to the front part of the eye. And if you get into things like erosions, abrasions of the cornea, that can be A, very painful, and B, it can leave a scar that can permanently affect your sight. So one of the main points is to just make sure that you listen to your body and, don't ignore it. If something doesn't seem right, come and see your local optometrist and get it checked out. Because sometimes it's really an easy fix if you will treat it sooner versus later. Sometimes you let these things go and they become a lot worse. The other thing real quick I wanted to touch on, as far as the beauty part of it. The ladies, we like our lashes. So we want to be glamour girls. A lot of us, we are glamour girls. We are glamorous.
How long can you get lashes, Dr. Reed? Do you know how long you can get those things? I've seen some that's like, man, they almost brushed up against me when a woman was walking by me the other day. But I'm just playing. But go ahead.
Yes, we know that some of the ladies, we like the really long lashes. There are different strokes for different folks. So no shade to anyone who likes the really long, glamorous, the dramatic look, we'll call it. But the main thing is with the lashes, ladies, because I am getting some patients who are coming in with some terrible allergic reactions or infections where I've tried, certain treatments, antibiotics not helping it, having to put these patients on sometimes oral steroids, and they're just absolutely miserable. And so, we want to just caution you to be very careful about the type of lashes that you're getting. And oftentimes, the old school strip with the glue is that you can just take it off at night and do a really good lid hygiene, cleaning of the eyelashes. It's, something that's so simple, but it's really, really important. You can take a little baby shampoo on a wet face cloth because it's no more tears. It's not going to irritate your eyes. Take those lashes off at night. If you have the reusable, maybe even the magnetic, sometimes I think it's the glue that's causing people problems. Maybe it's the new glue with the bonded lashes that are, that people are having more issues with, because I never had this years ago with the older version of the lashes. I didn't see this. I didn't have this many patients coming in with these terrible, terrible allergic reactions that, it's almost what we call like a cellulitis. So it can be pretty dangerous because your eye is connected to your brain. And so if you get a lot of infections set up in the front part of that eye, we have to be very careful that you don't need to be admitted to the hospital for some type of IV treatment to make sure that it's not going behind the septum or barrier that connects our eye with the brain. And I have one more thing, is that a lot of folks, when you have dry eye, or your eyes feeling a little irritated, we run and go get Visine to get the red out. But if you use that occasionally, it's okay. But the Visine gets the red out. If you use it constantly, it will cause what we call rebound redness. Right. Can cause your eyes to get more red. So what we really recommend for dry eye and just a general irritation is artificial tears. It's not medicated. It's just lubricating drops for the eyes. It comes with preservative or preservative free. And you can use that as little or as often as you like, typically, and that's not going to hurt you. So those would be some of the things to remember that we hope that you'll take with you.
That's why I'm glad that you're on the show with me tonight, because I have those things recorded, and I thought about those things, but mentioning the preservative-free, the one with preservatives, because preservatives can irritate your eye, so you may want to get the preservative-free that she's talking about when it comes to artificial tears. And remember, the artificial tears are just going to mimic your healthy tears there. You know, when I tell you healthy tears consist of water, your oil and mucus there. So when your tears are not healthy and you're suffering from dry eyes, sometimes the doctor will recommend artificial tears. And also making sure that you cleanse the eye area as well, keeping it clean, keeping the meibomian glands, you know, from being clogged. I remember in school, Dr. Reed, where I had to help express stuff that was clogged in someone's meibomian gland. I mean, it was very thick. Their glands, the lid was so thick because it was clogged that much. And the patient, not to scare anybody, but the patient was in pain as we were trying to give her relief. But she was very thankful at the end because she got relief, you know, from us, you know, getting the clogged stuff in her glands there out there, and everything, expressing that out of the glands there. So sometimes a warm, you know, cloth and a little massage there helps as well there too. But there's sometimes where you have to get on each side and just express what's clogging those glands out so that they can have relief from the dry eye issue.
Because you can get sty formation in the upper those glands.
Right. And some of this can be in the form of what we call a hordeolum, you know, as well there. It can be painful, and that's going to lead to more treatment that you'll need there as well. So just know that there are different things that can happen when it comes to the front surface of your eyes, the cornea. There are things that you can do to be proactive. There are things that you can do along with your optometrist guiding you to get dry eye relief there. So I hope that this show has been helpful for you guys there. And I hope that we've dropped some nuggets with you in regards to dry eye and UV safety for this month of July. And next month, we hope that you'll be able to join us for a different topic. Bring your children on. We're going to talk about Children's Eye Health Month and vision therapy as well. We're going to have some guest speakers on the show with us there. Dr. Reed, any final words that you would like to say to our listener audience? I do want to say, Dr. Reed, thank you for being so great at what you do, taking care of patients, coming off from work and jumping on this show with me. I mean, you are the partner that everybody should have. So thank you for joining this show with me and doing such a fantastic job delivering education and wisdom with the listening audience tonight as it comes to dry eye, UV eye safety. Thank you so much.
Oh, it's certainly been my pleasure. I just try to leave with people the things that are good for the health of your eyes are really the things that are good for the health of your body. Having a good diet, good nutrition, proper exercise, good rest, and good water intake, and to just really just listen to your body. I don't know if we have anything else in the chat, but that's about all I have. It's certainly been my pleasure to be with everyone this evening. And I want to thank everyone for, for listening and just for following us and their support.
Yes, and if we didn't get a chance to answer any questions, or maybe you made a comment in the chat there, thank you, Rosalind, for saying this was very informative. Thank you so much for that. You guys can leave comments down there. Let us know, have this been helpful for you? We also ask for you to let us know if you're dealing with dry eye issues, if you've gotten treatment, what was your treatment method from your optometrist based on the severity of your dry eye status there as well. You know, we keep this as a dialogue back and forth there. We are here as experts in our field, sharing information with our listening audience for free. That's what we do as part of the National Optometric Foundation. And I failed to mention at the beginning that Dr. Reed is also a board member for the National Optometric Foundation, our secretary as well. And just we're grateful to come as a tag team here to deliver this to you today. And we also want you to continue to stay connected with us. Stay connected with us on our Facebook page. Stay connected to us on our YouTube channel. Stay connected to us on our website. We are going to be launching a new website here, so stay tuned. We'll definitely post that in our Facebook group. When that new website launch, we're going to have a new website as well. And also, we have a Cash App. Our Cash App is $ protecting the vision. If you'd like to support us, any amount is good. You know, we ask that you know, if you can give $25, $50, $100, you know, we're a nonprofit organization, you know, so you can use that as a tax write-off as well there. We accept your donations. We appreciate your donations. We also appreciate our sponsors and our donors who have already donated towards the causes that we have here with the National Optometric Association and the National Optometric Foundation and the National Optometric Student Association, who's doing an excellent job in various optometry schools around the USA. So thank you guys for what you continue to do. Thank you to our listening audience for joining in with us tonight. Be sure to share this with your family and friends. You can also make sure you share how they can be connected to our YouTube channel so that they can go back and look at the previous videos that we have there as well. So if that's all, we're going to sign off and hope you guys have a great evening. Again, Dr. Reed, thank you so much. And thank you to our listening audience. And we'll see you on our next live show in August. The third Monday in August, we'll come again and talk about children's eye health and vision therapy. Have a great day, everyone.
Good night, everyone.